Now, as I've mentioned about replacements, joint replacements, and we have seen many replacements happening. I've seen few celebrities also endorsing knee replacements. For example, Ravi Shastri had a knee replacement recently.
Dhoni, yeah.
Yeah, so they had a knee replacement recently, and they have been telling that it has been helping them to walk. They are fine. They are able to maintain their weight and all of that. So, what is happening with the common people in India?
Yeah.
Why is there a myth? Why is there a fear when it
There
comes
is
to
a fear.
replacement?
Because many of my patients from the old city, especially, also from other areas of the city, other regions, they have been told that if you get a knee replacement done, you'll be in bed forever. You won't be able to bend your knee. You will not be able to walk. And people like to talk about the odd complication that somebody in their family might have had, and that's like Chinese whispers. It gets worse as it spreads around, you know. So, providing the doctor, the hospital setup, the theatres, and the whole ecosystem is good for having joint replacements done, then that's a place you should be going. Not somewhere where, you know, it's cheaper to get joint replacement there. You know, you need to look at the background of the pedigree of the hospital. Absolutely. It's very important. So I tell them, you know, any good worker in any profession, the worker has to be good to get a good result, right? And in orthopedics, especially in joint replacement, it's a team effort. I could do the most fantastic joint replacement, but if you don't have a good physiotherapist, if you don't put your mind to it, you will not get a good result. So for me, the approach is very different. I look at the patient first. I don't look at the X-ray, right? You know that this patient has severe arthritis just by looking and talking to them and examining them. X-ray just confirms your suspicion. Many people treat the X-ray, not the patient, because the patient has to be ready for it mentally, right?
Right.
They have been told that this and this happens, and the kids in America are pushing them to have knee replacement because they don't want to come and, you know, look after them, you know. So all these things are happening. So they are under pressure to get joint replacements done. The patient has to be ready to get the joint. Only then it will work well. So a good surgeon, a good patient, that's the biggest part of the equation, and a good ecosystem around it. So good pain management, like good anesthesia, good physiotherapy, good nursing, clean environment, clean theatres. That will get you good results.
Otherwise, it is all haywire because
you go to a gully and get a knee replacement done, you're not going to get a good result. So don't blame the knee replacement. Blame yourself.
Absolutely. And as you've rightly pointed out, everyone is important. The anesthetist and also the physiotherapist who is
absolutely.
Because that is what helps.
And most of all, you should be positive about it.
Absolutely. Yeah. That is it. So, otherwise, there's no point in doing a knee replacement.
That's right. So, and unfortunately, you know, like not just in India, wherever there is private practice, there's a lure of doing more and more and more.
Correct.
And the more you do, the more famous you become.
Correct,
you know?
correct.
And many orthopedic surgeons are just becoming knee replacement surgeons.
Right.
You don't need to do medicine to do knee replacement, right? So if you want to do knee replacements and make money, one needs to understand why do you need to go through the whole medical career? You know, just I can train you to do a knee replacement. And so it's important that the doctor also is holistic in his approach to any patient with knee pains, because knee might just be a manifestation of other issues.
Correct.
You need to realize. I mean, I've seen people getting knee replacements when the problem is actually in the spine or the hip. You know, so
because they're not able to walk, they're trying to.
And because they say the pain is in the knee, so there'll be a little bit of arthritis, and if the doctor doesn't examine and take history properly, you end up having the wrong operation. And so it's very important that you go to a place where there is a good pedigree of orthopedic surgeons who come from the right background.
Like and subscribe Eagle Health and Beauty.